We met November 1976, and it was the grand opening of Standing Room Only, a little 3-2 bar up in Oak Grove, and it was a Monday evening, and he asked me to dance, and he hates to dance. So we had that first dance, and here we are from 1976 till now, married 33 years, so 35 years later.
I was diagnosed in '96, and the only reason that how I was diagnosed, I had gone to the VA, and I believe the doctor said I had some sort of lung problem, and that's when I went to my regular doctor and got diagnosed. Job induced. I'm a retired bricklayer. It's from all the dust and stuff that you're breathing in on job sites.
Hospice care is intended for patients who have a life expectancy of 6 months or less, if their illness runs its natural course. Provided in the patient's home, hospice is designed to relieve the patient of physical discomfort, provide emotional and spiritual support, and prepare the patient for a natural death. But hospice is also family-centered, offering support and information for loved ones and caregivers. Patients are eligible for hospice once it is determined that life expectancy is limited and they choose to control their symptoms without the expectation of prolonging life.
It was in December is then when he started with the oxygen. And then I started with Allina Hospice as a nurse, and so I gained better understanding of qualifying, and he and I talked about it. Sleep is an issue. Laying flat is an issue. So we ended up talking about it and pursued the hospice component for him. It made sense.
Made real good sense.
Well, I think the biggest thing is to make sure that people do understand that there's just so much available with hospice, that it's a shame if you wait until the very last days to be able to utilize the program, not just for the loved one who's needing that care, but for the family as well. There's so much, and they are such compassionate people who work with the program that it's an amazing, amazing program. And there's so much available to the patients and to the family, so it's a shame if it's not utilized sooner rather than later.
Hospice care is coordinated by a team of healthcare professionals skilled in providing patients and families with a wide range of support services. Together with patients and families, the hospice care team develops a plan of care with the patient's doctor that honors the goals, values, and wishes of each individual.
When he was admitted into hospice, the nurse that he had admitting him did a phenomenal job of answering any questions, and she made sure that we were all aware of all the different resources that were available, not just to him, but to us as well as family. So it was educational. I, being a nurse, I have some background knowing a little bit about hospice, but my brother and my dad's sister were both here, and they don't know anything about the medical field. So it was very nice having that information, and it's just nice knowing that there is the support that when we need it, that it's there for us as well, not just for my dad.
Once a plan of care is determined, hospice provides the necessary resources for pain and symptom management.
It's typically such a defined stereotype word that you have less than probably 2 weeks to live. Because that's usually, people don't really reap the benefits. But the benefit of pain control that hospice can provide when you're diagnosed with a terminal illness is unbelievable.
Yeah, there isn't any reason to
Be in pain.
Be in pain. And that's one thing, basically pain-free. And, you know, it's the first time in years I've been without pain and been able to sleep longer at night than before.
Hospice care is covered by most insurers, including Medicare, Medicaid, and private insurers.
What I didn't realize is all of the equipment that's available to patients and medications, things that are covered, that, you know, the family doesn't have to worry about the cost of it. And that's such a huge stress on anybody with healthcare, is the cost. So, I mean, I think that that's a really big deal, and it's amazing to not have to worry about that, to have my dad be able to have a hospital bed so he can sleep comfortably, you know, to have him have the oxygen and have the medications that help him be comfortable. For us to not have to worry about that is really huge. I mean, it takes a very big stress off of us as a family.
Above all, hospice is about quality of life, however limited life expectancy may be.
Don't think of hospice as the last days of your life. Think of it as freedom and being able to be without pain and do things that you want to do. I like to hunt and fish and just be outside and enjoying nature.
Go out for breakfast with the guys, or
Yeah,
sit outside and start a campfire.
yeah, start the campfire and it'll be time to plant the garden here pretty quick.
You can't stop him. I mean, you try to say no, but he's just going to do it. That's how he is, and you know, he's going to do it, and he's able to do it in comfort now. So, you know, that's huge in my eyes. I think the biggest thing is just being with his grandkids.
Samantha and Cameron spend quite a bit of time here, and I do things with both of them. I've taught them both how to ride their bikes without training wheels, and the last 2 years they've picked out the flowers that we've put in the garden, and everything turned out great. Yeah, I have Sarah. She goes where I go.
British lab. And the British labs have a sense. They just kind of know.
And her and I bonded right from day one.
Allina Hospice has helped many patients and families on their path with compassion and care.
There's nothing wrong with being on hospice. You can still do everything you were able to do before. There's no limitations other than the limitations you put on yourself. And I don't put limitations on myself. I haven't given up anything that I've done. As long as I'm able to do it, I'm going to continue to do it.
It's a journey we're all taking together, but each on our own path.
Allina Hospice care services are available to anyone living in our service area, which includes 28 counties throughout Minnesota. For more information, please visit our website or call 1-800-261-0879. Allina Care Navigators are available 24 hours a day, 7 days a week.